Thank you for the opportunity to be here this morning. I'm delighted to share with you some information about an exciting program that we have launched at the hospital in collaboration with Wake Forest University and UNC Chapel Hill here in North Carolina. It's a project called We Can, which stands for Weight Loss and Exercise in Patients with Arthritis or Communities with Arthritis in North Carolina. And what this is it's a community-based clinical trial being conducted here in Haywood County, in Forsyth County, and in Johnston County. And it's focused on individuals who have knee osteoarthritis. And it's looking at the impact of weight reduction and exercise in management of their pain. So what is knee osteoarthritis? As a rheumatologist, I take care of patients with arthritis every day, all day, and there are over 100 different types of arthritis. But by far the most common kind of arthritis is what is called osteoarthritis. And it's a degenerative process where over time the cartilage cushion in the joint wears, thins, erodes, and breaks down, and results in a significant response by the body with bone building and spur formation. So on the left-hand side, you can see a normal knee has a nice smooth cartilage surface on the ends of the bone and a cushion within the joint that can degrade and become irregular and disrupted. And this is an x-ray image of what that would look like, how much narrowing there is of the joint, and all the bony response that occurs as that process happens. And it's no surprise that that kind of a change in a weight-bearing joint would result in significant pain. So what are the symptoms? People with osteoarthritis have pain that's usually worse with activity and improves with rest. They have morning stiffness, but it's not severe, in contrast to some of the other illnesses I treat, like rheumatoid arthritis, where patients may have hours of stiffness in the morning that they have to overcome as they begin each day. The joint enlarges because of bony enlargement. It may be unstable, and often one can appreciate what we call crepitation, which is this sense of clicking or catching as you move the knee through a range of motion that results from that breakdown of the cartilage cushion within the joint. So why is this important? Well, there are a huge number of people in our country who suffer with osteoarthritis. It's estimated there are about 30 million adults in the United States who have osteoarthritis. It tends to affect women more than men. It clearly limits people in their productivity, either their inability to do all of their job or their ability to work at all. It's a common comorbidity with other very common medical problems. So over half of diabetics and folks with cardiovascular disease are also limited by osteoarthritis. And it's estimated that 2/3 of the folks in our community who are overweight will develop osteoarthritis at some point in their life. And of course, for all of you as employers and for all of you as employees, this condition can result in significant cost to you and to our society. So what's a clinical trial? A clinical trial is a research trial that's focused on answering a specific question. And it engages people in the community to join with scientists to try and come up with solutions for better health or better health care. It involves randomization, which means that folks who volunteer to be part of a clinical trial have a 50-50 chance that they will get the real intervention. In our case, that's guidance with weight loss and regular exercise over an 18-month period of time. That means that 50% of the folks who sign up will not go into that active intervention. And in our group, there still are interactions that we have, but we need folks as they enter the clinical trial to be willing to help us as active interventionists or as members of the control group. So why do we think this might work? What tells us that there might be some benefit from weight reduction and exercise? Well, our colleagues at Wake Forest University published in 2013 an article called The IDEA Trial, and it looked at, in a very controlled academic setting, the same intervention. Folks over the age of 50 in need of significant weight reduction who exercised over an 18-month period and lost over at least 10% of their body weight. And what did they find? their pain was reduced by more than 50%. And the things that we typically offer folks with knee osteoarthritis, which are medications, give us 25 to 30% at best reduction in pain. So this is an effort, it's a pragmatic trial, taking this to the community to see, can we get those same results in the real world and spread that into other communities as well. So the funding for this work came from the NIH. It's a $6 million grant over 5 years. We are working in collaboration with the team at UNC Chapel Hill, but our other colleagues are the folks at Wake Forest. We have collaborators from Brigham and Women's, which is a Harvard-affiliated hospital, and folks at East Carolina as well as in Australia who are part of our research team. So what I'm looking for are folks over the age of 50 who need to lose at least 10% of their body weight and who have knee pain most days of the week. And so if any of you in the audience or any of your friends or family, we would be delighted to welcome you into this trial. And what we'll do if you call us and express an interest is evaluate you to see if you meet the criteria for inclusion. If you enter the trial and are randomized to the active intervention, then you would come to the fitness center at the hospital and exercise with us for an hour 3 times a week for 18 months. So it's a big commitment. And what we do is primarily walking as the intervention, but also strength training over that hour. And then we work very closely with you on a one-on-one weight reduction program that does have the opportunity to use a liquid protein supplement in the first 6 months to get your weight loss started. But at the end of 18 months, we hope that you've seen this improvement in pain and maintained the weight loss that you've achieved. If you go into the control group, we still interact with you and have a whole series of interactions, both face-to-face and with other social media opportunities to deliver information about general nutrition and health. So what we want to try to demonstrate is that this reduces pain, but we're also looking at self-reported level of function, what we call quality of life, and other measures of your activity. And we're also looking at cost effectiveness. So we have a group that are doing the cost effective work because our goal is that at the end of this, hopefully we'll be able to demonstrate that we have a product that can be implemented and disseminated, and that we also will have the evidence to take to third-party payers that this is the kind of health intervention that should be reimbursed by health insurance. So if you have any interest at all, I hope you'll give us a call. There's a card on your table that has information about the study and the number where you can reach us. If any of you in your place of business would be interested in helping us recruit, we'd be happy to bring by an advertisement with cards to disseminate. Just let us know. And I'd be happy to take a second to answer any questions.